Hi everybody, I'm Dr. Monique Barbour. I'm a board certified ophthalmologist here in Lake Worth, Florida, where I've been for the past 20 years. I understand that you may in fact be here today to receive an injection inside of your eye. I know that this is something that can be very stressful, and for various reasons you are scheduled to receive this injectable medication. Well, I'd like to tell you a little bit more about that procedure to kind of answer some of your questions and address some of the concerns that you might have as far as what your activities should be before and after the injection. Well, to start, the injection is performed here in the office. When you come in for this procedure, we would anesthetize your eye. So we would take you to a sterile area in the office where we perform such procedures and immediately start to prepare your eye. I use povidone iodine solution to clean your eyelid and eyelashes completely and thoroughly before this procedure is done. So I will be placing a drop of povidone iodine inside of the cul-de-sac of your eye, and we'll be vigorously scrubbing the lids and lashes. This helps to prevent infection. Following that, we place a lidocaine jelly-like substance in the eye to fully anesthetize the white part of your eye, which is called the sclera, where the injection then takes place. So this part of the eye is anesthetized for about 5 minutes. We'll put the drops in and ask you to keep the eye closed so that the anesthesia can take effect. After about 5 minutes, when your eye is thoroughly cleaned and anesthetized, I will then approach your eye holding the lids apart. One of my assistants will hold the upper lid and I will hold the lower lid apart so that the injection can take place. I will then take a small needle of a preloaded syringe of the proposed medication. That needle is then used to inject into this scleral area, approximately 2 to 3 millimeters behind the colored part of your eye. The injection will take place and then the needle is removed subsequently. At times, the injection will be felt somewhat, but we try to avoid that by making sure that the anesthesia is very composite. With this injection, the medication is then able to penetrate into the inside of your eye and get to the targeted tissue that needs it so much. Following the injection, you might see floaters, and that is simply the medication floating around inside of your eye. The floaters will last for about 6 to 12 hours. After that, the medication may settle down into the bottom of your eye, where it will continue to be effective over a period of 3 to 4 weeks, at which time you may come back to the office for an assessment to find out whether or not you need a second injection. Following this procedure, also, you should take it easy and not do any strenuous activity or do any underwater swimming. It is requested that you avoid those activities that may put you at risk to have an infection. So there you have it, the intravitreal injection of medication. Most of the time for diabetics or for macular degeneration or other diseases that can affect the retina. This is the reason why we do those injections. If you have any questions regarding intravitreal injections, please give us a call at 561-432-4141. Thanks for your attention.